economic losses both in dairy and beef kettles, and he has detailed spoken about a questionnaire about the economic losses which is caused by lameness. It is a short summary of his presentation. Now we can continue with the assistant professor Ünal Yavuz. He is going to speak about corrective trimming and therapeutic shoeing in laminitis and treatments in horses. Hocam buyurun, söz sizde.
Okay. Hello, dear participants. I would like to thank all participants, scientific board and organization committee. I will try to give information about corrective trimming and therapeutic showing in laminitis treatment in horses. Laminitis is a complex metabolic disease in which the integrity of the connection between the dermal lamina of the distal phalanx and the epidermal lamina of the hoof wall is disrupted, causes severe pain and characteristic lameness in the hooves. It's a local symptom of a general metabolic disorder such as digestive system disorders and diseases that cause endotoxemia. It often occurs as a sequel of diseases that produce gram-negative bacteria. If preventive measures are not taken, it's common after excessive grain feed consumption and cases of colonic torsion, enteritis, pneumopneumonia, and septic metritis. Dermal junction becomes edematous and weakened with loss of interlaminar bond. If this damage extends over a sufficiently large area, suspensory support of the distal phalanx inside the horn capsule is lost. A combination of the forces of weight bearing, the pull of the deep digital flexor tendon, and dorsal pressure of space occupying soft tissues result in mechanical separation of the third phalanx from the hoof ball. If, as in most cases, mechanical separation is mainly localized in the toe, the distal phalanx rotates away from the dorsal hoof ball. In very severe cases in which the suspensory support is lost through most of the lamina, the entire third phalanx drops in the hooves. The initial severity of the match between the dermal lamina of the distal phalanx and the epidermal lamina of the dorsal hoof wall is very important. Severely affected horses are unwilling to lift one of the front or hind legs. Front legs are more severely affected than hind legs. In cases where all feet are affected, the horse tends to lie down for a long time. Foot problems developing in the disease are classified as acute, subacute, and chronic. In the acute phase, the dorsal lamina in the toe of the hoof is more severely affected than the lamina in the heel. The subacute phase is difficult to diagnose. Pulse increases is evident. There is pain in the toe. In the chronic phase, rotation of the distal phalanx can vary from mild to severe. Treatment consists of nutritional regulation, medical treatment, corrective treatment, and therapeutic shoeing on the hoof. The aim of treatment is to prevent the development of laminitis, to reduce the pain, to reduce or to prevent permanent laminar damage, to improve dermal laminar capillar hemodynamics, and to prevent rotation of the distal phalanx. Therefore, treatment consists of nutritional regulation, medical treatment, soft bedding, corrective trimming, and therapeutic shoeing. Medical treatment is started with non-steroid anti-inflammatory drugs. For this purpose, phenylbutazone, fluniximab, ketoprofen, or dimethyl-sulfoxide are applied. The aim of vasodilator or antihypertensive therapy is to improve laminar perfusion. Acepromazine, isoxaprine, pentoxifylline, or nitroglycerin can be used for this purpose. Aspirin or heparin is used in anticoagulant therapy. Dietary supplementation of methionine and biotin to improve the quality and quantity of hoof growth may also be used to treat laminitis. Guided by good lateromedial foot radiographs, the angles and dimensions formed in a normal foot should be well known. Breakover has been defined as the most dorsal location of the dorsal aspect of the hoof capsule that contacts the ground during weight bearing, and its last part of the hoof capsule to leave the ground in the caudal phase of stride. The correct breakover point is determined on the toe, and corrective trimming is performed according to the breakover point. Removal of excess dorsal hoof wall in the toe and trimming of the heels to restore a normal spatial alignment between the third phalanx and the hoof. It also reduces the tension of the deep digital flexor tendon during breakover and exposes the back of the foot to weight bearing, which is generally the least painful region of the foot. The only trimming that should be done at the first examination of an acute laminitis case is to rocker of the hoof wall to approximately 15 to 20 degrees. The rocker is begun dorsal to the painful region in the sole. Rockering the toe is done to reduce weight-bearing forces on the dorsal hoof wall, thus reducing the continued laminar tearing and decreasing the leverage required for breakover. Pre-shaped frog pads, such as Theraflex pads, lily pads, or thermoplastic frog support, 3M custom foam, or roll gauze help transfer the load of weight bearing from the walls to frog. Support of the frog can be maintained such as Theraflex pads, lily pads, or thermoplastic frog suck, 3M custom foam, roll gauze, or roll of wet wrap. Alternatively, a 2-inch thick strong foot pad, which is roughly the diameter of the bottom of the foot, can be used to provide support to the frog and to the caudal half the 2/3 of the foot underlying the distal phalanx. This process is repeated and continued until the horse is comfortable and stabilized. After the horse becomes comfortable, it can be placed in the equine digit support system showing. Coronary growing has been advocated to promote dorsal hoof wall growth in horses with chronic laminitis that are exhibiting anormal growth in this region. The growth is deepened until the soft translucent or is reached. In this technique, a motorized rotary burr or a hoof rasp is used to create a 20 centimeter wide growth in the hoof wall parallel to the coronary band. The types of shoe that are used most commonly include heel bar shoes, adjustable or non-adjustable, reverse shoes with pads, egg bar shoes, shoes with pads, elevated heel shoes, equine digit support system shoes. Plastic shoes have also been advocated. The purposes of these shoes are to increase the base of support, minimizing the amount of pressure on the sole and facilitating of the foot. The heel bar shoe is basically a bar shoe with an extended V-shaped frog plate. It's designed to apply pressure to the frog, thus supporting the distal phalanx. To be effective, it should extend forward to cover at least the caudal 2/3 of the length of the distal phalanx. This shoe is difficult to make and apply properly. Elevating the heel decreases the pull of the deep digital flexor tendon and appears to improve the blood flow to the dorsal lamina through the dorsal artery of the foot. An 18 degrees heel wedge has been recommended. Elevating the heels should minimize the physical tearing of the susceptible lamina during the acute stage of the disease and thus potentially decrease the amount of movement of the distal phalanx within the hoof wall. The durable plastic equine digit support system pad is used in conjunction with the equine digit support system shoe. It has a stainless steel insert embedded in the toe region for a firm attachment to the shoe. The molded equine digit support system frog insert attached to the cared base on the equine digit support system pad. The height of the frog inserts can be adjusted to increase or decrease support through the impression material to the frog bars and sole of the foot. This will help enhance blood circulation and heel expansion. Full athletic recovery is still possible for horses in which rotation does not exceed 5 degrees. A prognosis becomes hopeless in case of sinking of the third phalanx, exsanguination of the foot. Corrective trimming and therapeutic shoeing plays an important role in the treatment of laminitis. It should be done correctly and without delay to ensure normal angulation between the distal phalanx and dorsal hoof ball.
Professor Yavuz, excuse me, can you give me 1 minute for an announcement?
Corrective trimming and therapeutic shoeing plays an important role in the treatment of laminitis. It should be done.
Hocam özür diliyorum. Sanırım bir duyuru var arada.
Okay.
Yes, you can make your announcement.
Okay. I have shared a Google feedback form link in the chat box.
Okay.
We are unable to get the attendance of some of the participants in the chat box. So all the participants who want to get the certificates, they must fill this form. Once they will go to the chat box, they will click on the link and this form will be automatically opened. Then they will fill the form and will submit. And all the questions are mandatory to respond. Yes, and once they will submit and we'll get the response. But problem is that most of the participants have started filling this form right now, although we have not completed the session 3. And one question is which session you liked most, session 1, session 2 or session 3. And they can compare all the sessions at the end of the conference. So I may request all the participants to stop filling the form and they should submit this form at the end of the event. And now you may announce all this in Turkish to the participants from Turkey who are not fluent in speaking or understanding English.
Okay, thank you very much for the information. I have filled this document to check if it properly works. There is a problem with the documents because there is a question if yes or no. The second question is necessary if you give your answer as no. If you select the yes, then you have to fulfill again the next question.
I'm going to rectify it.
Okay, thank you very much. I will do the announcement in Turkish now.
Okay, you may announce in Turkish.
Saygıdeğer katılımcılar, Mian Muhammed bir form gönderdi. Bu form toplantının sonunda yapılacak. Çünkü sorulardan bir tanesi hangi oturumu daha çok beğendiğimize yönelik bir şey. Katılım belgelerini alabilmemiz için bu formun doldurulmuş olması gerekiyor. Toplantının 3. oturumu da bittikten sonrasında Zoom meeting kapanmayacak. Herkes formunu tamamladıktan sonrasında